Hi, I'm Gavin Giovannoni, and I'm one of the co-leads for the work stream that's targeting the social determinants of health as part of our Raising the Bar initiative. As you're aware, social determinants of health are usually the things that happen outside of the medical environment that affect health outcomes. This includes levels of deprivation, poverty, the lived environment, overcrowding, access to education, and all the things that improve the quality of life for people living in general society and for health outcomes. Now, our psychiatry colleagues have stolen a lead on us, and that they've been known for decades that social determinants of health predict outcome in terms of mental health. In other words, people with depression and anxiety that come from lower socioeconomic strata in society, the poor, have much worse outcomes in terms of suicide and depression rates than people in the upper strata of society. We're almost certain that this applies to multiple sclerosis, and we haven't yet studied this formally in MS. So when we actually had this meeting, and our underlying ambition was no patient left behind, we thought we should at least review the field of social determinants of health on MS, do some work to see if we can identify issues, and then in the future maybe incorporate some of the lessons into clinical practice to see if we can improve outcomes. So in our first meeting, we just simply identified the issue of social determinants of health. At the coming up meeting, we'll present some preliminary data about how this affects potential access to treatments and how it may potentially affect outcomes. And in the future, we're going to do prospective studies to see if we can improve outcomes by, for example, incorporating social prescribing into our clinical practice. Now, social prescribing is things that happen outside of the routine or the traditional medical model. They occur in the community, for example. And how do we improve social capital, in other words, the social networks of our patients with multiple sclerosis? MS is a very socially isolating disease, and in a recent MS Society survey, 3 out of 5, that's 60% of people with multiple sclerosis felt isolated or alone. Can we do anything to reduce loneliness? Because loneliness has negative inputs, negative outputs for people with the disease. So that's the kind of things we're going to do. And we would like to encourage everybody who works in the field of MS to engage with this campaign, which I like to call Think Social, to think beyond the medical model of managing disease. So if you want to manage MS holistically, what can we do to improve outcomes? But just to give you an example, in the COVID-19 pandemic, it's quite clear that people from low socioeconomic strata, people from poor families with overcrowding are much more likely to get severe COVID-19 and die from COVID-19. Now, there's a lot of factors involved in that, but it also will almost certainly be applicable to people with multiple sclerosis. And I'm aware of that because the Americans have just studied this and they've shown exactly this. So being from an Afro-American or a Hispanic background, being trapped in poverty, increased their chance of getting COVID-19, probably because they were working in jobs that increased their interaction with people, overcrowding where they live, etc., which put them at risk of getting, first of all, getting infected with the virus, and then also put them at risk of getting a worse infection. We want to study that in the UK to see if it has an input in the UK. How does it affect you as a practicing healthcare professional or somebody who may be working in the field? Well, maybe you could do something. When last have you asked somebody with MS whether they're food secure? We're seeing a massive increase in the number of food banks and people having to use food banks just to have enough food to eat at the end of the month. And I'm aware of certain MS centres in the country where they've actually do that routinely, and they've got a little portfolio of patients that have got food insecurity and need to go to food banks. So those are the kinds of things we should be thinking about incorporating and addressing in our practice. So please log on, register, attend our next Raising the Bar meeting. There are no limitations to the number of people who can register, simply because we're doing it virtually. And the good thing about virtual is no limitation in terms of space. And the incremental costs of running a virtual meeting are relatively small. So we want as many people from as many MS centres across the United Kingdom, not just England, Scotland, Wales, Northern Ireland, to register and come on board and start thinking about what you could do to help us in the social work stream. I look forward to seeing you at our Raising the Bar meeting. Thank you.